Hamstring injuries are still posing a huge problem to sports medicine, particularly concerning the high rate of re-injury. Once a player returns to sport, their risk of re-injury is nearly a third within the first year. And as a sports rehabilitation specialist, that's such a high probability and too high of a risk. It kind of highlights a lot of issues with conventional rehabilitation type models, in which players are not being prepared to return to sport effectively. We're not appropriately restoring function prior to returning a player to the team. It also highlights that the criteria to return a player to sport is probably insensitive, and we need to look at standardising that return to sport criteria to reduce the risk of re-injury. I guess the main strength of Isokinetic is that we manage sports injuries. So we take a player from the point of injury, so we do the clinical diagnosis with the doctor, and we take them through a phased orientated rehabilitation approach that begins with a physio. We focus on the early stages of rehab within the gym and the pool, right the way through to myself on the field, where I prepare the players to return with the team. The first phase of rehabilitation really focuses on reducing pain and inflammation. Okay, and then once the pain and inflammation is reduced, we can progress on to phase 2, which has much more focus on restoring range of motion. Once the early phases are controlled, really sports science should take hold of a player and really prepare them for conditioning and return to sport. Okay, so phases 3 have a focus on strengthening of the muscle group, but not just the muscle group in and around the joint, but also kind of the strength of the whole kinetic chain. Okay, then that will progress on to phase 4, which focuses on muscle coordination and proprioception. So a lot of balance type work, a lot of kind of pelvic control. And the final phase on the field will look to restore sport specific skills and take a player through a progressive rehabilitation program in which they can kind of begin with linear based running right the way through to kind of high speed multi-directional based work. Warm-up is very often overlooked, but it's actually an integral part of any rehabilitation program and effectively can reduce the risk of re-injury during each session. So it should focus on looking to increase muscle temperature through use of jogging, implementing static dynamic flexibility work, as well as looking to implement some kind of core activation work, so looking to switch on the gluteal muscles, gluteal max with kind of bridge exercises, as well as the kind of glute medius side action exercises. Okay, so looking to switch on the core, looking to improve muscle temperature and range of motion. Okay, then you have to take them through kind of progressive multi-directional change of movement to look to prepare them for the nature of football, which is high speed. There's acceleration, deceleration with rapid changes in movement. Take them through a kind of a phased orientated warm-up. Trick number 2 is to look to implement kind of high speed running, to have a high volume of running. And this can begin in the gym environment, okay, with use of treadmill. So as soon as an athlete's pain-free, look to have a high volume of running, whether this is at 30%, 40%, 50% of their maximum speed. Just need to get them back as quick as we can and expose them to a high volume of running. You know, we can look to use GPS technology, or we can look to use speed gates in which we can track the velocities they're attaining during each run, look to log that, and then we can record those values and kind of use that as a baseline marker upon returning to sport. So we know that the first time they step onto the field with a team, or the first competitive match they play, they've already had that exposure to high speed movement. Okay, so there's less risk of re-injury upon the first sprint, less risk of re-injury on the first acceleration.
Next important trick is to look to implement multi-directional based work. Football specific movement involves rapid changes of directions, cutting movement, acceleration, deceleration type exercises. Okay, and we have to implement those multi-directional based movement within the program. So this should look to proceed with very easy kind of forward, backwards movement, looking to then move on to kind of lateral based movement, kind of diagonal based movement, and then looking to kind of proceed onto high speed, rapid changes of direction. Looking to prepare an athlete to kind of prepare for kind of 1v1 situations and the high multi-directional speeds that they'll be exposed to within a competitive environment. Kind of most important aspect of on-field rehab is to look to implement some technical specific skills. So you have to create an environment which mimics exposure to what players will receive when they're back with the team. Okay? And that's kind of the point that most players are looking forward to in the rehabilitation process. When can they get back out in the field? When can they touch a ball for the first time? So it's really important to still take them through some progressive based technical work. So very simple exercises at the start, looking to implement very easy kind of volley type exercises, short range passing, looking to progress on to get them to experience a very realistic high speed 1v1 situation. Experiencing those kind of rapid accelerations, those rapid shots, very high velocity type movements, then you'll know they're ready to be kind of returned to the team. You've given them exposure to football-specific movements. You know they're ready to be exposed to that football environment, but you also need to develop that aerobic conditioning base, okay? Because a player can be very good during normal movement, but as soon as they're exposed to fatigue, mechanics can change, and then that risk of re-injury can be raised again, okay? So one of the biggest risk factors for re-injury is a poor level of conditioning, so you have to implement that aerobic and anaerobic type conditioning work into the program, and that's best done at the end of the session, slightly more safe, controlled environment, but really looking to develop that aerobic conditioning. Okay, so we need to look to expose a player to a football-specific environment, know they're ready, but also assess them from kind of aerobic, anaerobic fitness, looking to utilise isokinetic testing methods and standard objective criteria for when a player is ready to return to sport. Okay, so an on-field rehabilitation program will expose them to the environment, so you know they're prepared to perform football movements, but by implementing aerobic and anaerobic based testing, you also know that their conditioning levels are high enough to be able to return to sport and not be exposed to that fatigue, which could be the important factor for re-injury. The final factor is, once you return a player to sport, you know that they've gone through a progressive on-field rehabilitation program, you've set the benchmark for their criteria for return to play. It's important to implement risk minimisation of re-injury. So have a preventative program in place that's not only going to return a player to sport, but keep them fit as well. Okay? So for me, it's really important that the coaches and the medical staff work together on this, and you have an acceptance that even though a player has been returned to the team, they're ready for squad selection, they're fit, but they still have a risk of re-injury. Okay, so it's important that when players return to their team environment, they're classified differently. They're classified as fit, but at risk. An individualised prevention program or risk minimisation program is put in place for those players, and they need to be treated separately to the rest of the team. And you need to always have in the back of their mind that that risk of re-injury is still there. You need to constantly focus on the prevention measures, look to minimise the risk factors which can cause re-injury, and look to overcompensate on the factors that can minimise that risk of re-injury. We believe that our on-field based rehabilitation practices, our criteria for return to play, and our advice on preventative measures are effective at minimising the risk of re-injury. And in our experience, utilising all these factors can effectively reduce that level of hamstring re-injury. Okay, and that's kind of a beauty and a strength of the history of Isokinetic.